I'm going to explain about my entity diagram. So this is an entity relationship diagram, also known as ERD, whereby the entities, we have the patient. So the patient entity represents individual patients, like with attributes like patient's ID, the full name, the date of birth, gender, and phone number. There's also facility as one of the entities, which represents healthcare facilities with attributes like facility ID, facility name, location, and facility type. We have the resource entity, which represents resources available at facilities such as beds, equipment, and also staff. There is the training entity, which represents training programs offered to the staff who work in the healthcare staff, with attributes like training ID, training type, and completion status. We have the test entity. This entity represents medical tests performed on patients with attributes like test ID, test type, test date, and test results. We have the treatment entity, which also represents the treatments administered to patients with attributes like treatment ID and treatment outcome. We have the outcome entity, which represents patients' outcomes, attributes like outcome ID, outcome name, and outcome description. We have the case entity, which represents individual patient cases with attributes like case ID, patient ID, facility ID, and type of diagnosis. We have the epidemiological data entity, which represents epidemiological data such as rainfall, average temperature, and malaria cases. So we also have part of our ERID diagram, we have the relationships, whereby patient can undergo multiple tests, patient can receive multiple treatments, patient can be associated with multiple cases, facility can provide multiple resources, facility can conduct multiple trainings, training can be added by a technician, test can be conducted by a technician, case can have multiple outcomes, resource can be recorded at a facility, epidemiological data can be associated with multiple cases. So, additions, dimensions represent many-to-many relationships. For example, a patient can have many tests. A test can be performed on many patients. The Coffos notation indicates the cardinality of the relationships. For example, one-to-many or many-to-many. These attributes of each entity are listed within triangles. So this ERD provides a high-level overview of the database structure, which helps to understand the entities involved and how they are related to each other. This information can also be used to design and implement the database schema. Thank you very much.